have pain with you know what or any type of insertion, and it is like a burning, stinging, raw type of pain around the vaginal entrance, this is called vestibulodynia. It's a subtype of vulvodynia, and one of the subtypes of vestibulodynia is inflammatory. And in cases of inflammatory vestibulodynia, we often start with someone who maybe has a genetic predisposition to having some sort of infection, so something like yeast infections, bacterial vaginosis, etc. And in some cases, we have the infection, we have that pain, the infection goes away or it gets treated, gets managed, and the pain goes away. But in some cases, when people have repetitive infections in this area, we get a little bit of a vicious cycle that happens, and the mast cell activity releases something called nerve growth factor, which then causes an increase in C-type neurons or pain neurons to be grown in that area, and then they then encourage more mast cell activity, and then that also increases the nerve growth, and it just turns into a nice little vicious cycle. And this is something that's called inflammatory neuroproliferative vestibulodynia, where it starts out as an inflammatory issue, and then it turns into neuroproliferative, where we actually have an increase in nerves or pain nerves around that vaginal entrance that causes that increase in pain. Common patient presentation for this type of issue also includes people who have a lot of like allergic reactions to things like soaps. They have very sensitive skin or tissue in that area. It tends to get red and irritated very easily. And then again, that just predisposition to having a lot of infections.